Hey everyone, Cameron here with Boomer Health Group, and this video is going to be talking about hospital indemnity plans, which is really a fancy way of saying it's an insurance product that is designed to reimburse you in the event that you're hospitalized for any reason. So you may be thinking to yourself, why do I need a hospital indemnity plan if I have Medigap and most of my healthcare costs are already covered? And to that, I would say this is really more of a conversation for people that want to go with Medicare Advantage plans or Part C. Not saying you can't have this with a Medigap plan, but this is really a conversation that if you choose to go with Medicare Advantage and you understand the differences, we have to talk about hospital indemnity because it's a huge topic for everybody and it's a product that complements Medicare Advantage perfectly. So if you have accepted the network limitations and some of the out-of-pocket expenses with Medicare Advantage, and that's the plan for you, I strongly recommend at least looking at a hospital indemnity plan or seeing how it pairs with your coverage. And the reason for that is really when you look at it, so again, with Medicare Advantage plans, if you see here, I'll try to zoom in, but your maximum out of pocket, even though it's a low cost plan, you still may have to pay a few $1,000s per year if emergencies happen or if you have health conditions. So just because it's a low premium does not mean it's low cost when you actually do go to the doctor or hospital. And you can see that right here. So if you're inpatient hospital coverage or if you go to the hospital, for days 1 through 6 with this plan, you are paying $225 each day for 6 days. So that can add up pretty quickly, where if you have a couple hospitalizations in the year, you're already at probably $3,000 right there. Even outpatient stays, if you have surgery, that may cost you $150. So, really, hospital indemnity plans are to protect you for the out of pocket costs with Medicare Advantage plans at a lower price. So, they're typically going to run, $30 a month, maybe up to $40 a month, and they're designed to cover what your out of pocket would be if you are hospitalized. And not just hospitalizations, but if you see here, I'll scroll down to it. Ambulance as well, you can get the plan to cover an ambulance ride. So this $175 per ambulance would be covered if you choose so with a hospital indemnity plan. And this is another big one. So hospital indemnity plans also come with a optional benefit where you can add a cancer lump sum benefit. So if you do get cancer or need chemotherapy, it can help pay for this 20% that you're left with on a Medicare Advantage plan. If you don't want to go the hospital indemnity route and you're comfortable paying the out of pocket expenses should something happen, let us know. And there's also standalone cancer products to where if you're more concerned with the 20%, there are cancer insurance plans that we talk about in other sections that can help you specifically for these situations. So real quick, I'll go to the hospital indemnity example, and you can see here they're really designed to complement Medicare Advantage plans. So you can choose a benefit amount. You can say, I want my plan to pay 6 days for, I want them to pay me $250 for 6 days, which happens to line up perfectly with what I showed you earlier, which is the $225. Sorry, it's kind of tough to scroll on this, but you can see here it's $225 for each day for 6 days. Go over to the hospital indemnity plan, you can have 250 of that covered, so you'd actually get $25 extra, and then you'd get that for 6 days. So you can do this for 3 days, 6 days, 10 days. You can even add the ambulance benefit rider, like I said. So if you're concerned about paying $175 for the ambulance, you can do this for only a couple bucks a month. So I would say that's more than worth it. Some of the optional benefits are not necessarily going to be as beneficial, like outpatient surgery. I wouldn't necessarily recommend it unless that's something you're more concerned with. If you want to add the cancer benefit, like I said, you can even add a $10,000, $15,000, or $20,000 lump sum to where if you are diagnosed with cancer, not only will this plan pay for a hospitalization, but it will also pay for your cancer diagnosis or at least give you the lump sum when you're diagnosed with it. And another quick thing to point out is this is not just for one hospitalization. This is if you're hospitalized again after 60 days going forward for the life of the plan, it will pay for those reoccurring hospital stays as long as there's more than a 60-day wait period in between. So don't think you're spending $30 a month just for the first hospitalization or the first time you have an ambulance. These benefits do recur through time. So again, it's a great way to protect yourself for out-of-pocket costs at a much lower monthly rate. Just like any insurance products, you're trying to avoid the catastrophes that come with high out-of-pocket spending. So let us know if you want to look into these plans. They are affordable,